Puberty is a period of transition from childhood to adulthood, sexual maturation, process of biological, psychological, and the social, physical development through which the sexual reproduction becomes possible. Teenage, adrenage, and the peak growth spurt of menarche and ovulation. Age of onset of puberty varies between 9 and 13 years and lasts 2 to 3 years. The difference in the age of onset of puberty among the males may be explained by the increased giving. Endocrine mechanism underlying the puberty. Early in the puberty, sensitivity of the gonadoblast to the negative effects of the low estradiol decreases. Late in the puberty, maturation of the positive E2 level feedback initiates a LH. Basal levels of the pituitary gonadal tract increases throughout the puberty. Estrogen is mainly responsible for the skeletal maturation of the long bones during the puberty. 85 grams is the approximate weight of the thymus gland at the puberty. Hormones required during the puberty are LSH, testosterone, and leptin. Factors affecting the time of onset: genetics, race, nutritional status, general health status, altitude, physiological status, psychological status, and the exposure to light. Stages. Turner and the Marshall described the 5 stages of the pubertal changes: physical growth and weight gain, development of breast, pubic and the axillary hair, development of ovaries and the genital organs, growth of spurt and the maturation. First sign of the puberty is the development of the breast, and the breast budding is 9 to 11 years, indicative of the competence of the hypothalamus, pituitary and the ovarian axis. The adrenals are the main sources of the androgen, responsible for the growth of pubic and the axillary hair. First sign of the puberty in the female, Tanner stage LI. Vulva vaginal mucosa becomes multi-layered, vulval skin keratinates, and the resistance to the infection fat is deposited in the labia majora. The uterus grows rapidly, and the pre-pubertal ratio of uterus or cervix of 1:1 changes to 2:1 or 3:1. The ovaries start developing the primordial follicles into the Graafian follicles. The initial menstrual cycle are generally anovulatory for about 12 to 18 months after the menarche, follows the deluge by about 2 years. Orthorexia for the cryptochrysum is done at the age of puberty. 2:1 is the ratio of the length of cervix and the body of the uterus before the puberty. According to the standard stages of development, deluge is the first sign of the puberty in female. The first sign of the puberty in girl is breast budding. 35 grams is the approximate weight of thymus gland at the puberty. The difference in the age of onset of the puberty among males may be explained by the increased inhibin levels. Estrogen is mainly responsible for the skeletal maturation of the long bones during the puberty. Gamma-aminobutyric acid has an inhibitory control over the GnRH neurons before the onset of the puberty. Teenage puberty, growth spurt, menarche is the correct order of the events of the puberty in a girl. Hormones required during the puberty are LSH, testosterone, and leptin. First sign of the puberty in the female, standard stage 2. Sign of puberty in boys is the enlargement of the testes.